Hey guys, how you doing? Dr. Thompson here, author of Transformation 28 and doctor here at Exemplify Health Center. And I want to talk to you about a common question that a lot of people tell me, because this is a common occurrence in a lot of people. We think it's something that's a lot of older people actually get, but in reality, a lot of younger people are suffering from this as well. So the topic for today is why bloating, indigestion, and reflux are making you very sick. Now, oftentimes we think that bloating, indigestion, reflux are just like normal things, or it's just due to stress, or whatever. But I'm going to show you how having bloating or stomach indigestion, acid reflux, why it's actually creating a lot more problems than just discomfort. And I'm going to show you actually why, and why you need to do something about it yesterday. Now, just make sure you watch this to the very end, because I'm going to give you some solutions at the end on how you start addressing this, but I'm going to go over all the different areas that this is going to affect, and it's more than just having reflux or just having pain, but how it actually can lead into things like autoimmunity, how it can actually lead into even cancer, and how it can actually lead into things like osteoporosis, bone loss, even leading into the granny posture. So let's talk about why bloating, indigestion, and reflux, why they're making you very, very sick. The first thing I want to talk to you is I want to talk to you about the stomach. So there's a very specific reason why we have a stomach. So the reason why we have the stomach is for two reasons primarily. Number one is that when we eat food, the stomach is designed to mix and to break down food. So it's going to mix and it's going to churn the food. It's going to increase the surface area of it. And it's also going to be releasing acid in order to help break down those foods. So you break down carbohydrates, you break down fats, but you also only break down proteins in the stomach. So that doesn't happen in the mouth. It actually happens in the stomach. So it's going to help to break down foods, specifically proteins. Now, there's another reason why we have a stomach too, and why there's a lot of acid in the stomach. The second reason why we have a stomach is to help sterilize your food. Listen, there's going to be times where we're consuming food that's going to have bacteria and pathogens in it. And so the stomach is designed to actually help to kill off those pathogens so that you're not getting food poisoning all the time, especially if you eat actually some bad food. So let me say that again. The stomach is designed to mix and break down your food, specifically proteins, but it's also designed to help sterilize your food. Now, let me show you an example. So what happens? So I want you to think about this. The stomach is actually designed to be very acidic. And the stomach actually has protection in there so that when you release this hydrochloric acid or this stomach acid, that it doesn't actually eat away at your own stomach. That's how acidic it's actually supposed to be. So I want to talk to you about like ulcers, and I want to talk about reflux, because a lot of times, people throw that term around a lot, yet we don't know exactly what it is. Well, here's what happens when you don't produce enough acid in your stomach. Without enough acid, you're going to have either ulcers or you're going to have reflux. The first thing I want to go over with you is actually what an ulcer is. And basically what an ulcer is it's an erosion of the lining of the stomach, and so that you're exposing the tissue underneath. So when you look at a ulcer, for example, about 90% of ulcers are actually caused by a bacteria infection. So I want you to think about that. If that's a bacterial infection and the purpose of the stomach is actually to sterilize your food, then the only way that infection can take hold is if in fact you're not producing enough stomach acid. Now, what happens is when you eat and you have that exposed tissue in through that area, then as soon as you pour something that's more acidic over it, then that's when it's going to create that pain. But one of the things that we do is we actually reach for the antacids in order to reduce our stomach acid, in order to reduce the pain. But in fact, the only thing that it's actually doing is then making it worse. So with someone who has some kind of duodenal or stomach ulcer, then what happens is they eat the food, it releases some acid, but it basically feels like you're putting rubbing alcohol on an open wound. Now, the second one that can happen is going to be GERD or reflux. And here's why this happens too. Now, this isn't the only reason why this happens, But I want you to think of it. If you're not producing enough acid, you're not sterilizing food, so you can get this H. pylori infection going on. But if you're also not breaking down your food enough, well, your stomach can actually sense this. So if you eat some food, you're not producing enough acid, the stomach's trying to mix the food together. Well, what happens is you have little sensors right in through here, and it's called the pyloric sphincter. And those sensors are actually saying, is the food broken down enough? And if it hasn't, then that sphincter is actually going to close, and it's going to propulse the food back into the stomach to go through another round of mixing and breaking down again. Now, sometimes when that happens, or that happens all the time, as soon as it propulses that food back up, it can actually go back in through the sphincter into your esophagus. And here's what happens. So you have some very acidic type of food, or they call it chyme, that's been broken down. And if it goes up into the reflux, that's not protected either. And so you have this exposed tissue to a very highly acidic environment. So then it starts to erode the esophagus. That's when you actually have Barrett's esophagus. This is actually when you can develop over a long period of time of constantly exposing that esophageal tissue to that acidic environment that can actually turn into a situation of cancer. So again, those two things that you need to do in order to mix the food and sterilize the food, you need to be producing enough acid. And I know that you're asking the question, well, how do I produce enough acid? Well, at the end, I'm going to go over what you can do in order to start producing the right amount of acid to start breaking down your food the way that you're supposed to. Now, here's the third thing that can happen when you're not producing enough acid. So when you're not producing enough acid, you're also not breaking down your proteins. So you're not breaking down the proteins like they need. So again, the hardest thing for things to break down are going to be the proteins. Not producing enough stomach acid, you're going to be not going to be breaking down proteins into its most smallest elements, which is going to be known as amino acids. So your internal environment, your body can absorb amino acids, and the immune system doesn't respond to amino acids, but it will in fact respond to large proteins. So, hey, Dr. Nate, how do you get these large proteins to actually get into the blood? Well, there has to be some way for those to be able to get through the lining of the small intestine, to make their way through, and then to go into the bloodstream. And that's where the immune system starts to see it and starts to attack it and start to produce antibodies against it. So if you're not breaking down your proteins very well, this can lead to a lot of food allergies. So when we see people who have 27 different food allergies, like in this case, what it means is, first and foremost, is they're not breaking down their foods very well. But the second thing that has to happen is there needs to be some kind of injury to the intestinal lining for that, what are known as gap junctions, to actually be able to separate so these large proteins can make their way through into the body. So these can be things like having chronic stress. These can be having a lot of antibiotic exposure. This can be due to chronic infections. This can also be linked to gluten. So when you say gluten-free, I'm 100% for that. Now, there's other things that are combined with gluten, and that would be things like glyphosate or Roundup that have also been shown to damage the intestinal lining, which then produces something called leaky gut syndrome. So as soon as those large proteins are starting to make their way into the body and the immune system starts to attack it, what happens is it produces something known as inflammation. And listen, inflammation, we talk about it every single inflammation talk, how inflammation is the start of almost every single disease out there. In order for you to have a chronic degenerative disease, there has to be an inflammatory process first. So having problems with digestion can in fact lead to food allergies. Here's the fourth thing, or third or fourth thing that can actually lead to as well. This is the formation of bone loss or osteoporosis. I want you to think about this. Now, there's many different reasons for osteoporosis or losing bone mass. There's a hormone response. You also need things like phosphorus. You need things like vitamin D. You need magnesium. But you also need calcium. And remember, in order for calcium to be absorbed, stomach acid has to be very high. So you need a high amount of stomach acidity in order for the body to actually absorb calcium. So what happens when we're taking a proton pump inhibitor or Nexium, the purple pill, or we're taking those Tums? Well, we're lowering the stomach acid, and when we lower the stomach acid, we're interfering with calcium absorption, which is why now they actually say that if you take a proton pump inhibitor for 3 years, you significantly increase your risk of having a hip fracture because of lack of calcium absorption leading to osteoporosis. But listen, this is not all just the only factor with osteoporosis. I have women all the time who are, have either osteoporosis or osteopenia, which is the beginning of osteoporosis. And they're always saying, well, what can I do in order to improve my bone density? There's a lot of different things that you can do to improve bone density, like doing vibration platform therapy, by doing weight-bearing type exercises, which, by the way, has to be more than just walking, has to be weight-bearing and weight type exercise in which you're actually loading the spine, loading the hips, and you're loading the shoulders with actual weight. But the first thing is improve your digestion and improve your stomach acid. So what are some other things? This comes actually from PubMed. So PubMed actually said that a reduction of gastric acidity may impair effective calcium uptake through the intestine. Now, there's also some drugs that will actually cause a loss of bone mass. This would be corticosteroids. So how many people do you know are taking corticosteroids? Either corticosteroid drugs or corticosteroid injections, anti-diabetes drugs, acid-reducing drugs that we just talked about, even antidepressants or SSRIs, and then either anticoagulants. So some people are taking like heparin, for example, to prevent blood clots in other parts. Just know that when you're doing that, you're actually causing bone loss leading to osteoporosis. Let me give you an example of this, of how you can actually see this on an x-ray. This is actually a 14-year-old girl. See, what I want you to know is that your issues with reflux just didn't start when you're 50 or when you're 60. These things have been building for years. So this is a 14-year-old girl. She's not digesting any of her foods very well. Now, you can look at this and see a scoliosis that's taking place, and we're going to be working on this as well. But actually, if you look into her stomach, you see a large presence of stomach gas. And that stomach gas is an indication she's not digesting her food very well, specifically probably not digesting proteins very well. And then you see a lot of intestinal gas. And that intestinal gas is actually a diagnostic criteria for inflammation that's happening in the stomach and in the gastrointestinal system. So she is, at 14 years of age, setting herself up for having reflux, for having food allergies, for having leaky gut syndrome, for having osteoporosis. And yes, she's actually setting herself up with autoimmunity. And if you look at the link between increase in gastric permeability or intestinal permeability and autoimmunity, the research is clear that that is one of the first things that has to happen for any kind of autoimmune response to take place. And this is in a 14-year-old girl. So a lot of you are saying, well, where on earth do you start? And there's a lot of different things that you can do to improve your digestion. Here's the first thing. Chew your food. So that means chew the food and help it to break down easier. So when you're chewing your food, you should chew it enough to where it's almost liquid within your mouth. Now it's actually time to be digested easier in the stomach. You don't chew enough, then the stomach has a lot more work to do to try to break down the food. Here's the second thing. Don't eat on the run. So a lot of us now, we go and we just grab lunch, we go grab dinner, and we're eating in our car, we're eating on the go. The thing is, when it comes to food, is for you to produce the amount of enzymes, for you to even to start secreting stomach acid, it needs to be a process. You need to be sitting down. You need to smell the food. That actually is the first step in digestion, is seeing the food and smelling the food. Then the act of chewing will stimulate secretion in the stomach. So eating and making it an event versus something that you just need to get out of the way will have a huge effect on how well you're digesting your food, particularly in the stomach. The third thing is aloe juice, apple cider vinegar, digestive enzymes. Not all three usually, but one or two of them. And what these things will actually do is this will help to increase your stomach acid and also help your pancreas to secrete digestive enzymes to actually help to break down even further your carbohydrates, and specifically your proteins. I mean, you can actually see the presence of specific enzymes in your stool to see if you're making even enough enzymes to help with the breakdown of proteins in particular. The fourth thing is get food allergy testing. And the reason why this is important is because food allergy testing tells us a lot of things. It tells us how you're breaking down your food. It tells us how the immune system is actually reacting. The food allergy testing is just not a test to look for things that you should just avoid. It's telling us how you're digesting your food and how your immune system is actually reacting. And yes, you should avoid your food allergies, but we also want to know why. Why are you getting exposed to so many foods that your immune system is actually reacting to? The next thing is an x-ray. So you can see how well you're digesting by looking at an x-ray. And then finally, chiropractic care. This sounds crazy to a lot of people, but remember this. One of the greatest benefits of chiropractic care is the ability of when you are affecting the spine, you're affecting the nerve system. The nerve system that you're actually affecting the most are your autonomic nerve system. So people who have chronic issues, especially in through the middle part of their spine, which is anyone who has been in a car accident or sits for long periods of time, what happens is they tend to develop what's known as an increase in sympathetic tone, or this fight or flight response. And just remember, anytime that you're in fight or flight, you immediately stop digesting. So this chronic fight or flight response will stop digestion, and you're not going to start secreting stomach acid. Now, here's the thing. Being able to get off of acid reflux medication and things like this, if you do the right things, I've seen people who have been on it for 10 years get off of it in 2 weeks. I've seen some people get off of it in 4 to 6 weeks if you just figure out what's causing it and start to do the right things. So it's much more than just being uncomfortable from having reflux or having an ulcer. It really is about lowering inflammation and having an immune system that is rock solid. When you start doing that and start understanding that it's more than just my microbiome, it's more than just a probiotic. Actually, digestion is one of the most important things that can happen, because it's actually where you are gaining your minerals, your vitamins, and your energy from the system. This system needs to be absolutely rock solid. Hey, so if you have a question, or you say, hey, this is me, what do I need to do? Just head on over to exemplifyhealth.com and send us a message through there. We'll promise to get back to you. Leave me a comment, leave me a like if you have a question, or send me a message. I'll be happy to answer to you. And guys, if you guys enjoyed this, next Wednesday at 7:30 p.m., we're going to be talking about our T28 nutrition plan. So this actually comes from my book, Transformation 28. And the book does a great job of telling you the why and why you should eat a certain way. But this webinar is going to talk to you about the how. How do you make that happen? Because the hardest thing for a lot of people is that they know what to do, they just don't know how to implement it. And we're going to talk about something that is super easy and it's doable for you to do. But this is not necessarily a lifestyle. This is an intervention. So if you're someone who suffers with a lot of chronic inflammation, if you're someone who wants to start losing weight, if you're someone who has a problem with sugar cravings, if you're a person with problems with stubborn weight loss, things like that, then this webinar is going to be just for you. And so make sure that you tune into that, because we're going to talk to you about everything that you need to do, what you do over 28 days, what you need in order to make that happen. And we're also going to talk about something that I've never talked about before, and this is the difference between men and women, and why women typically lose weight slower than men, and the hormone connection between the two. So guys, enjoy your Wednesday night. Hope you're having a great week, and tune in next week for our next Facebook Live, in which we'll talk about T28 nutrition. We'll see you later.